First of all, I want to tell you I've been a nervous wreck, worried that this wasn't going to come on. And so we're glad that that's happened. I want to tell you my history real quick of how I got involved with this. I was a GSE team leader. That stands for Group Study Exchange, for people that hadn't been in Rotary for years. I was devastated when Rotary in our district did away with Group Study Exchange. Ann and I hosted 22 or 24 Group Study Exchange teams at our lake house. And like I said, I was devastated. But Bill Davis from the Rotary Club of Humboldt Intercontinental came to the Rotary Club of Westview and said, we want to put together a vocational training team. And I was asked to chair. And so what I was trying to do is Charlie Tharp had brought in a vocational training team of doctors from Japan a couple years ago, and the district really never saw them. They just went from the hotel to the medical center and back. Well, we came back and tried to make it a combination of group study exchange and vocational training team. So we came back, and the vocational training team from Uganda lived with Rotarians. And we came back, and on the weekends we tried to show them Texas and Houston and tried to make it a combination of the two. So we are fortunate. We have Dr. Michael Oketcho from the Uganda Heart Institute. And we did have challenges in that if everybody, there were 12 people selected, if all of them came at one time, there was nobody at the Uganda Heart Institute left to take care of the people, the patients in Uganda. So we brought them in 2 separate groups, and they came for 2 weeks each time, and that was a challenge compared to group study exchange, because we had to have host families that were close to the Texas Medical Center, where in the past you would ship them off to Brazosport, to Brenham, to different parts of the district for 2, 3, 5 days. Here we had to find them all close to the inner loop where they could come back and go to Texas Children's Hospital. I want to give a shout out to the Rotary Club of Houston Skyline. Ed Pettit put it together where Texas Children's Hospital hosted all of these people, and we had in our budget to pay Texas Children's for them doing that. They wouldn't accept any money. They just made them pay for meals. So, Michael, first of all, I would like for you to tell us about the team, how you were chosen, what you expected and what you experienced, and then we'll go to questions.
Hi, everybody.
Hi.
It's good to see you. You are appearing a bit dark, but I can see there are people seated and watching. My name is Michael Oketcho. I'm a cardiothoracic surgeon. I work at the Uganda Heart Institute here in Kampala. And I was privileged in the year 2013 to be among the 9 members who were selected to come over as part of the VTT. We had a wonderful experience there, and I think it was worth the time. We still remember it, and we appreciate the different Rotary clubs for the arrangement and for hosting us and for making it possible for us to go to visit the Texas Children's Institute. Jack, you say I'm supposed to tell you how we were selected?
Yes.
All right. The proposal came from the Rotary Club of Kampala North, who came and sold this idea of the Uganda Heart Institute to get a few people come over as part of the VTT. I don't remember whether the numbers had been agreed upon before that, whether the numbers were agreed on in the discussion. This team would focus on children, treatment of children with heart disease. So it was agreed that a team would be selected among the members of Heart Institute who probably had an interest in taking care of children, or maybe those whose strength was in looking after children, or you could say those who would also be earmarked later on to concentrate on looking after children. And among those, there was one who is a pediatrician. So that was Dr. Ali Kutwali. So his line of specialty is already pediatric. And being 2 weeks, it was also decided that, are you still hearing me?
Yes. Yes.
It was also decided that the members who come should be members who have already undergone specialized training in the different aspects of cardiac surgery. So the different areas were identified, and these were cardiac surgery, pediatric cardiology, perfusion technology, cath lab technologists, cath lab nursing, theater nurse, an anesthesiologist, and 2 critical care nurses. We thought that that would form a team that looks after children during, before and after surgery. So having decided the different areas of specialization under which people would be sent, we now went down to selecting among, in those areas, who would be the candidates. So being a small institution, we don't have many people. So in some of those areas, you find only one person. So the choice was probably already made for some areas. But even for those who, where there were a number of people, the selection, I think, was based on someone who is willing to learn, someone involved in teaching, willing to teach others. In surgery, we were 2 surgeons at that time. And so, as an individual, I think the selection was made according to the outlook for the institution for future, on which of these 2 they want to develop as a pediatric surgeon, and also based on the different opportunities one had had. So as it happened, I think I was the one who was being assigned to pediatric cardiac surgery at that time, and my senior colleague had had more opportunities than I had had to be exposed. So the selection was made. Should I go ahead?
Yes.
I think that is about it regarding the selections. Expectations, I have consulted with about 2 members of the team that came. I would have wanted to get them to go, but after being a Saturday, I was not able to get them together. But I noted down 9 things, and some of these will be kind of repetition. But let me read them out according to what I gathered from the colleagues. So the first one was to be exposed to current practices in care for children with cardiac disease. in the different areas of those 9 specialties that I have mentioned. We hoped to attend and participate in clinical discussions. We were not registered, so we did not really expect to be able to practice, but at least to participate in discussions, attend, and see what is being done. So, which goes on into the third one, which was to see how patients are managed in a different setting, different kinds of patients, and also the same kind of patients that we see here. We hope to be able to study the protocols at Texas Children's Hospital. We hope to be able to explore the technology, the new technology available, and the best practices. One of the things that we hope to do was to study the patient flow, see how patients move into hospital, how they're channeled to different areas, patients who are going to surgery and other cardiac intervention, to see how the system worked and how the system flowed. We also wanted to study and see if and whether there were any procedures which could be adopted locally. I think as we came, of course, we wondered how receptive the members of the partnering institution would be. It would be nice if there was a member from Texas Children's Hospital there. And lastly, we hope to explore partnerships for future partnerships, and also maybe future training opportunities.
Okay,
that is it as far as the expectations were.
Personally, Michael, what did you get out of the exchange? Besides,
so all those expectations were met. I hope you can hear me still.
yes, we can.
Okay. The hosting institution was very, very receptive, very warm, ready to teach. And I think that was very important. We were able to participate in various discussions for the different members of the team, because since we are different, we are involved in different areas. But it probably was an advantage because we had one person in each area, so it was easier for one person to assimilate with the rest, with the members of his specialty in that hospital. We were able to get involved in patient management. Much as we did not actively participate in treatment, we attended the discussions, had discussions, exchange of ideas, and definitely learned many things. So the results we got is, I would say, all-round knowledge, exposure, and new insights working in a first world institution. One of the biggest things was confidence building. Much as the technology was superior to ours, we appreciated that many basic practices are similar. If I would say, like, driving a car is the same thing, whether you're driving in the States or in Uganda, the same principles in driving a car, though they're all exposed to are different. So we appreciated that the practices are similar, and I think it was very, very inspiring to see that what they do at Texas Children's Hospital is not very different from the way we do things, and hence the realization that we could do as much as they do if we put our hearts to it and we take time to practice and perfect what we do. We had our knowledge polished up, brushed up, and definitely learned some new things, a few new things. One of the important things was to borrow on protocols in patient management in the different areas of those specializations. If I give you an example of the ICU nurse, Jane Francis, I think she said that she got a lot of infection control, which she has managed to implement back home. Things like maintaining the different tubes and the different lines that the patients have, when to remove them, when to change them, when to dress them, that kind of thing. I think one of the other things that we got, according to another team member, was a more efficient management of time and other resources. The other thing that definitely happened was better team communication and cooperation. I think it teaches you to see how other people work, and I think we gained in that area. Another one was learning to be very specific in patient management, in articulating problems, articulating things that need to be resolved, and how to resolve them. And possibly because of the confidence building, the realization that we can do it, and of course, other positive factors back home. Since we came back, we have had more regular surgeries and procedures, and as a result, we have patients being worked on more regularly, and the numbers are a little better than before we came over there. The big limitation was the time. 2 weeks was rather short to want to fully appreciate how the different system works. I think that's about it, Jack.
Very good.
Hello?
Michael,
Yes.
hang on one second. I'm going to open it up for any questions.
All right.
Anybody have any questions about vocational training team? Okay. Go ahead, Wally.
If they would do it again, what would they have done differently?
Wally Kronzer asked if you could do it again, what would you do differently this time?
That's a good question. I would have to think hard about what I would do different. One of them was done with the second group because of the 2 groups that came. I came in the first group, and we did notice that we included social activities in those 2 weeks. And as such, we did not fully concentrate in the hospital. I think the second team had an extra week in which the social activities were put. So that was a good improvement already. I think the one thing probably I would have done I would do different now is to link the members of the team to the members they are going to visit the other side. So the surgeon can have the opportunity to have a chat with the surgeon on the other side. The critical care nurse can have an opportunity to have the chat with the critical care nurse on the other side. So that before they go, they have an outline of the different activities they are going to have, the different discussions, the different planning areas. I think that is the one thing I would do different.
Thank you very much, Michael. We're ahead of schedule. I appreciate you taking time.
Hello, Jack.
Yes.
So my name is Anna. I'm a medical student at Baylor who is currently on my surgery rotation at Texas Children's. And in vocational training, we always talk about how what we can give to the host
was asking
All right?
that it's a give and take situation. What could you come back and tell Texas Children's to do different that y'all do in Uganda that would make them a better institution?
That's a very tough one. That's a very tough one because I'm sure, as you all know, we visited a very highly regarded institution world over. And being an institution that is leading in their area of specialty, and compared to ours, which is really very small compared to them, I really don't have, I don't think I have anything to tell them where they can improve.
That's good to hear.
Not only is their clinical practice good, but the interpersonal relationship, the way we were received, the opportunities we were given was excellent. So for now, I don't have anything to tell them in terms of how they can improve.
She says that's very good to hear. What are you going to ask, Wally? Michael, once again, we want to thank you for your time. Thank you for coming over.
My pleasure, Jack. My pleasure. It's been great talking to you again.
Michael, thank you.
Pleasure. Bye-bye.
Bye.
I want to tell you one other funny story about that. They come in and I have two of them or three of them in my car, and coming back from the airport, it's about midnight. They're hungry. So where do you take them? Whataburger. So I take them to Whataburger over on the Southwest Freeway near West U. We're sitting there, and then all of a sudden, one of the guys jumps up and he runs out of the Whataburger. I'm going, what in the hell has gotten into him? He goes, it's Lakewood Church, Joel Osteen. I watch him in Uganda on TV all the time. So Carol Lester and the West U Rotary Club called the church, and they went over there several times, and they just loved it. It was just amazing how the reach that Joel Osteen has. And one other funny